If you're dealing with esotropia, we're here to help you understand a new, non-invasive therapy approach that could change how you see the world.
Literally.
We'll be diving deep into the experiences and insights shared by a user named AliteracyRocks,
Okay.
who from now on we'll just call A-Rock.
Makes sense.
He's got some really fascinating insights into treating his own esotropia.
And what's really amazing is his dedication to documenting his whole journey and sharing it with others.
Yeah, and that's what makes this deep dive so interesting.
For sure.
We'll be unpacking his method and understanding its potential.
Sounds good.
Now, A-Rock talks about something called the Bielchowski mechanism.
Yeah.
What is that exactly?
Yeah. Well, it's basically a specific type of esotropia that's caused by this imbalance in the muscles in your eyes.
Okay, so like a muscle imbalance.
Exactly.
Interesting.
Yeah, so each eye has 6 muscles that control its movement.
Okay.
And there are 2 that are key players here.
Gotcha.
The medial rectus and the lateral rectus.
Got
Now,
it.
the medial rectus, that's the one that pulls the eye inward.
Inward.
And the lateral rectus pulls it outward.
Okay, so they're kind of working against each other.
Exactly, like a constant tug of war to keep those eyes aligned.
Got it. A tug of war.
Now imagine one team in this tug of war gets way stronger than the other.
Oh,
That's basically what happens in Bielchowski esotropia.
interesting.
The medial rectus, the one pulling inward, becomes overactive,
Okay.
and the lateral rectus, the one responsible for outward movement, weakens.
So it gets weaker.
Yeah, and this imbalance, throws off the alignment, causing the eye to turn inward.
I see. So it's like one muscle is overpowering the other.
Exactly.
That makes sense. But why would one muscle get stronger than the other?
That's a great question. And A-Rock and some research out there point to our modern lifestyles as a big contributing factor.
What do you mean?
Well, think about it. We spend hours staring at screens.
Oh, yeah.
Our phones, tablets, computers.
Sure.
All this near-focus work constantly engages that medial rectus, making it stronger.
Oh, so it's like a workout for that muscle.
It is. And meanwhile, the lateral rectus,
The one pulling outward.
the one responsible for looking off into the distance, that one's underutilized and weakens over time.
Like a muscle you never exercise.
Exactly.
It just kind of gets,
Yes.
loses its strength.
Exactly.
So you're saying all the screen time could actually be making our eyes turn inward.
It's definitely something to consider.
Wow, I never thought about it that way.
Yeah. And A-Rock even mentioned that his esotropia seemed to worsen after prolonged phone use.
Oh, really?
Especially when he was feeling down and, scrolling for hours.
I can see that.
It just suggests a strong link between all those near-point activities and this type of esotropia.
That's a little concerning considering how much time we all spend on devices these days.
Hey, no kidding.
So let's talk about solutions. A-Rock wasn't a fan of the more traditional treatments.
Yeah, like prisms and surgery.
Right. He felt they didn't address the root cause.
Yeah, that they were just kind of masking the problem.
Okay. Why do you think that was?
Well, think about it. Prisms, they bend the light to help your eyes focus better,
Okay.
which helps with the double vision,
Right.
but they don't actually strengthen that weakened lateral rectus.
Yeah, that makes sense.
It's like using a crutch. It helps you walk, but it doesn't actually heal a broken leg.
Good analogy.
So you're still dealing with that underlying problem.
Right. What about surgery then? Isn't that a more permanent fix?
Well, surgery can realign the eyes, but it comes with risks.
Obviously.
Yeah, and there's no guarantee that the double vision will completely disappear or that it won't come back.
The esotropia.
Yeah. A-Rock felt that, if the muscle imbalance is the root cause, maybe we should focus on fixing that.
Instead of jumping to more invasive procedures.
Exactly.
Okay, so what was his alternative? How did he approach treating his esotropia?
Well, his therapy focuses on strengthening those weakened lateral rectus muscles to restore balance.
Okay, so kind of like rebalancing that tug of war.
Exactly. And his method involves this simple eye exercise he calls prolonged side gazes.
Prolonged side gazes.
Yeah.
That doesn't sound too complicated.
No, not all.
Can you walk us through it?
Sure. So imagine looking as far as you can to the left,
Okay, to the left.
and then as far as you can to the right, holding each gaze for an extended time.
Okay.
We're talking minutes at a time.
Minutes. Wow. Okay.
Yeah.
So we're basically giving those lateral rectus muscles a workout.
Exactly. It directly targets and strengthens those muscles responsible for pulling the eyes outward.
Makes sense.
It's like any other muscle in your body. The more you work it, the stronger it gets.
And as those muscles get stronger, what happens?
Well, as your lateral rectus gets stronger, they'll be able to better counter the pull of that overactive medial rectus,
Oh, okay.
gradually bringing those eyes back into alignment.
So it's about restoring that balance.
Yeah, that's the key.
That seems pretty straightforward.
Yeah.
What are some things people should expect when they try this exercise?
One thing that AROC emphasizes is you might experience a temporary increase in double vision after doing these exercises.
Oh, really?
Especially when you first start.
Is that normal?
Yeah, think of it like muscle soreness after a good workout. It's a sign that you're challenging those muscles.
So it's a good sign.
It is. A good night's rest should help your eyes recover and adapt. It's just like starting any new workout. You might feel a little sore at first, but as you keep going, it gets easier.
Sure.
And the benefits really start to outweigh that initial discomfort.
So did this approach actually work for AROC?
Well, that's what makes his story so fascinating. He reported significant improvement in his esotropia after a few months of doing those prolonged side gazes consistently.
Wow, so it actually worked.
It seems so.
That's really encouraging, especially since we're talking about a non-invasive way to address something that often leads to prisms or even surgery.
It's pretty remarkable.
So was he just an isolated case?
That's a good question.
Did other people see results with this method?
This is where the comment section gets interesting.
Okay.
AROC's post really resonated with a lot of people.
I can imagine.
And many shared their own experiences trying this out.
That's great.
One comment that stood out was from someone who was initially using prism glasses,
Okay.
but they found them to be pretty inconvenient.
I can see how that would be annoying.
Yeah, and like a constant reminder of their esotropia.
I can see that.
So they were hesitant to try AROC's method at first, but they decided to give it a shot. Within a couple of weeks, they noticed a big improvement in their esotropia.
Wow. Just from doing the exercises.
It's pretty incredible.
What kind of impact did this have on their life?
Well, this is where it gets really inspiring. They described being able to have conversations without feeling self-conscious about their eye turning in.
That's huge.
Yeah, they were able to enjoy watching movies without needing to wear an eye patch.
It's amazing.
It just shows the potential of this simple exercise.
To actually make a real difference.
In someone's life, exactly.
Yeah. It's kind of counterintuitive, isn't it?
It is.
Like, just strengthening a muscle can have such a profound effect on your vision and well-being.
It really challenges the conventional thinking that, esotropia always needs prisms or surgery.
Right.
AROC's story really encourages us to explore alternative therapies that target the root cause.
I love that.
Yeah.
So for someone listening right now who might be feeling a little lost or overwhelmed, what are the key takeaways from all of this?
Well, first, understanding how this type of esotropia works is crucial. That Bilshowski mechanism, with its focus on that muscle imbalance between the medial and lateral rectus muscles, gives you a clear picture of why this condition develops. And that knowledge empowers you to find targeted solutions.
So knowledge is power.
Exactly. And AROC's therapy, which focuses on strengthening that lateral rectus with those prolonged side gazes.
Right.
It seems like a really promising avenue to explore.
It does. Simple yet effective.
Absolutely. It's simple, it's accessible, and most importantly, it's non-invasive.
Yeah.
It's a low-risk option that could potentially lead to significant improvements.
That's fantastic. But it is important to note that we're not medical professionals.
Right, of course.
And all this information is based on AROC's and other users' personal experiences.
Yeah. And while these accounts are super encouraging, it's always best to consult with a healthcare professional.
Absolutely. To see if this approach is right for you.
Yeah, definitely get personalized advice from a healthcare professional.
Exactly.
Someone who can really assess your individual needs.
For sure.
And guide you on the best way forward.
It seems like AROC's approach is really changing how we think about treating esotropia.
It is, isn't it?
Instead of just trying to compensate for the eye turn with prisms or surgery.
Right.
He's saying, hey, let's address that root cause.
Yeah, the muscle imbalance itself.
Which makes a lot of sense when you think about it.
Absolutely, and it raises a really important question.
Okay, what's that?
Could actively addressing that underlying muscle imbalance offer a more sustainable, long-term solution?
Compared to just compensating with prisms or surgery.
Exactly.
Yeah.
It's something to really think about.
Definitely something worth discussing with your doctor.
For sure.
AROC's journey is a great reminder that sometimes the simplest solutions can be the most effective.
They really can. His dedication to finding something that worked for him and then sharing it with everyone is truly inspiring.
Yeah, I agree.
It shows that there's always hope and that we can take control of our own health.
Absolutely. So if you're out there struggling with esotropia, remember AROC's story.
Keep exploring, keep learning.
Yeah, and keep those lateral rectus muscles working.
Don't give up hope. There are solutions out there.
That's right.
And with the right approach, you can improve your vision and your quality of life.
That's it for this deep dive into AROC's method for treating esotropia.
Hope you found it helpful.
We hope you learned a lot.
And maybe even feel empowered to explore new possibilities.
Absolutely. Until next time, keep diving deep.